Hey there, everyone. This is History in Lowell, and I'm Maritza Groom, coming to you virtually on Zoom with my virtual professor from Zoom University now, right?
Yes, my employer is Zoom University.
Hey, Bob. And we've got Clare Gunther here with us today, the Chief Advancement Officer of Lowell Community Health Center. Thank you for joining us.
Oh, thanks for having me.
Yes. So, Clare, pre-pandemic, before all of this, a little bit in our recent history, you were going to be our next guest in the studio. And we were going to talk about some things that Bob actually was working on with the health center and the history there. And I guess we can start there. Let's talk just a little bit about the importance of a community-based health center and where that idea all came from and how Lowell Community Health Center came to be.
Great. Well, this is probably not how we wanted to celebrate our 50th anniversary, but we are celebrating our 50th anniversary this year. The health center was founded in 1970. It was an initiative of Lowell General Hospital to get services where people needed them. So they opened a small clinic in the Shaughnessy Terrace public housing complex, which has since been torn, the apartment has since been torn down. And it was women's health, well child, and very limited dental services. The health centers are part of a social justice movement that came out of President Johnson's war on poverty. The first health center was in Columbia Point in Massachusetts, with another one in rural Mississippi. So there was one urban and one rural. And they're housed in communities where there is a shortage of access or a lack of access to healthcare for underserved communities. And as a side note, they were also workforce development initiatives because they provide a lot of living wage jobs to people in these communities. When we're fully up and running, which is not right now, we employ almost 500 people. So the health center has, a lot to thank Lowell General for recognizing the need. We became an independent nonprofit in 1985 in order to access federal funding that was made available to what are called federally qualified community health centers, and that's how we're classified, along with funding, which is it's less than $5 million a year is what we receive through the federal government. But just as important, we also receive, they provide for doctors a malpractice insurance, which is a huge cost. So that's the other benefit of being a federally qualified health center. We're committed to serving the population of Lowell and Greater Lowell, including cultural competency, with a real focus on cultural competencies. So we provide medical interpretation to anyone who needs it. One day we counted, we did it in 61 different languages. And we don't turn anyone away due to inability to pay. So I would say those are the major tenets of a community health center. But we're a full service health center. We provide all the services that any for-profit health center or private pay health center provides.
I got my last pair of glasses there.
Yeah, I got these there.
So,
and that's fairly new, right?
I should have mine on.
Yep.
I was going to put them on so I could be a walking advertisement for that part of the facility. So the question I have, which always, when I go by there, and when I was working with everybody there on working on a timeline on the history, it always amazed me that people had the vision of taking that big space, which I had been inside of it many times before it got even the beginnings of development. It looked like it had been in a war. And how people, walked in there and said, oh, we can turn this into this incredible 6-story community health center. Like, where did people get that vision from to then be able to, manifest it, obviously, right there now for everybody to see?
And continue manifesting.
Right. Well, there's a ton of things to go around for that. Dorcas Griggs-Saito, our former executive director, who has since retired, was really driven to find a consolidated home for the health center, because previous to this, we were located in locations throughout the city. So women's health was in one location and pediatrics was in another, adult medicine was in another. And we really wanted to have this idea of people being able to get their care all in one place conveniently, and in a lovely setting, in a setting that told them that they were valued and they were that everyone deserves quality health care. So during the Obama administration, during the recession and the Recovery Act funding came out, there was funding specifically for community health centers. And we were one of 85 health centers from throughout the country to be awarded. We received over $9 million, which was really what made it possible for us to move forward. And it was funny, I was just talking to Steve Jonkus the other day, he's done a tremendous amount of work with the health center to get this up and running. And he was saying he happened to run into Dorcas at an auto repair shop, and before he knew it, they were walking over to Appleton Street to look at the mill and talk about, how do you turn this former mill into a health center. I'll say that the vision of this community it was sort of a bold idea, and the community embraced it, and we were able to raise over $5 million initially toward funding for this project. And then Eastern Bank, which is our financer, really worked with us because, again, it was a leap of faith. And we have tax credits, new market tax credits and historic tax credits. So it was I heard somewhere that the documents, when we all had to sign, there were 500 of them to sign. So it was a huge undertaking. And then there's these amazing architects, DBVW architects based out of Providence, who just did a lovely job of preserving the integrity of the building and the history of the building while also making it modern and functional. So many hands in that soup.
It's interesting that you sort of, as a way to think about transitioning the conversation till now, that it was out of another deep economic crisis that when President Obama came in and had to figure out how to re-stimulate and get the economy moving again, that money goes there to provide jobs for the people doing the work, but also in the long term, understand the relationship between, as you so clearly described it, the relationship between actually having medicine on the ground for everybody and how much that matters in such a diverse community as Lowell. So it's when I think about, I'm writing a book now on Lowell history, and the way you describe it, it's very Lowell, right? That people always had, it was when the park came in, it's people thought this is mental. What are we doing? Right? Each time the university has expanded, somebody looks at it and says, are you all crazy? And somehow people, donors, people that have lived their lives in Lowell and done well, giving back, and there's this really elaborate infrastructure of goodwill, which I teach obviously history a lot, and I don't see it everywhere. There's something I don't know what it is. Somebody told me it's in the water, but that makes no sense. Water's water. But it is pretty amazing when you laid that out, how many times people had to say, well, I don't know, but yeah, let's try.
Right. And even historically, when it was just becoming a thing, I'm thinking of the times, the 70s in Lowell, and what was going on at that time, even in an economic way, right? So it seemed, Lowell Community Health Center has really made itself what it is today in terms of being that space for the people, right? And growing over time and really being a community-based center in so many different ways. And as you said, like making sure that all of these different languages are available, which I think is incredible and extremely important considering our diverse population. But not only that, not only do you offer health services, but there's also the community atmosphere that happens. There's so many other things that take place in that building that's not just about health. So it truly is a community center. Again, now we know the space of that, we understand the importance of a community-based health center and what is going on, how is that, what is going on now that is, is it still that community-based health center? What happens in a time like this?
Well, at a time like this, it really underscores that we are a public health cog in Lowell. There's the City of Lowell Health Department, there's the hospital, and there's us, and we all work really closely together to make sure that needs are met. But our laser focus is on making sure that not just our patients, but people who lack access in the community have a place to go, have the resources they need, and know that they're cared about. And that's really been a focus. Now it's become much more difficult because we made, again, another bold decision by our chief clinical officer, who's also in charge of what we call incident command, which is how we've gotten through this crisis. She made the decision 3 weeks ago to get everybody out of the building because we don't have the personal protective equipment that we need to keep everyone safe. Mm-hmm. And also the trajectory of this virus is very little understood, even less so 3 weeks ago. So we only have a skeleton crew working in the building right now. Our pharmacy is open. We have, the Lowell General has a lab that is open during the week. And then we have just a few doctors and clinicians on site and some facilities folks and our HR folks. Everyone else is working via telehealth. So most of our patients are being seen through the telephone. And what's interesting about this is we've long wanted to do telemedicine, but we weren't reimbursed for it. So it was financially impossible. 3 weeks ago, the governor made the decision that given this crisis, telehealth could be reimbursed. We stood that program up in 3 days. And right now, I think yesterday we saw close to 900 patients via telemedicine, and that's for behavioral health as well as for substance use and for primary care.
That is incredible.
Yeah. And we're hearing great stories because sometimes you actually have a better conversation over the phone. We're hearing the teens love it because they're all about the phone. That's what they're comfortable with anyway. But that being said, we still are, so we're not offering dental or eye care services right now. Dental requires a tremendous amount of the PPE, and it's also just not safe to practice dentistry in this time. We do provide emergency services for both eye care and dental. But given that those two services have been suspended for now, and that our specialty services, so the doctors who come in for the specialists who come in periodically have been suspended, our visit volume is down at about 40%, which is huge and barely sustainable. It's really a difficult time for us. We've been fortunate that we got the CARES funding, which was a little over $1 million, and Mass Health gave us a $2.7 million advance, but we have to pay that advance back starting in January. So it's I don't want to say it's robbing Peter to pay Paul because it was sorely needed, but it's not a long-term solution. So so we're really struggling right now because health centers, by and large, struggle in the best of times. Our Medicaid reimbursement had not gone up in about 5 years, but our expenses have gone up. And things like interpretation are not even covered. So we've got to pay for that. And we're really committed to being out in the community. I just talked to a CHW who delivered a wheelchair to someone today, and it took an act of Congress to get that wheelchair, and then she loaded it in her truck and drove it to his house. And that's still going on.
Wow.
So that helps explain then, because while all this was going on, I've kept reading about like Mass General or Brigham and Women's or other big hospitals laying people off. And I was thinking, wait, this is counterintuitive. We're in the middle of the greatest sort of global health crisis since 1918, and places of care are laying people off. But that's the reason why, because normal business isn't happening. The sorts of reimbursements you would count on a regular, I don't want to say routine, but on a regular basis, those are dropping. And you can have people walk in who need immediate attention and then trying to figure out, okay, well, how do we get reimbursed for this somewhere out in the future? It's, as you said, it's not sustainable.
Right.
So do you think, I mean, part of what I've been thinking about with all this going on, part of the historian in me, right, thinks about, I wish I was still going to be on the planet in 2050 to look back and see if we learned anything from this, right? And it seems to me a lesson that at least I think about with this is the importance of these community health centers, and thus the responsibility to keep them adequately funded, teched up the way you're talking about with the personal protective equipment. I mean, my brother's a nurse at North Shore Medical, and we go back and forth with, do you got the stuff you need or don't you, and whatever. And so I have a personal sort of, it's not me, but he is my brother, and my sister works in a care capacity at North Shore Medical as well. It's troubling to think about how we've not, as one of these really wealthy societies on the planet, we've not done a real good job thinking about these sorts of things. Now, you can never predict this, right? So it would be irresponsible to say, well, everybody should have known this was going to happen. But you can't also manage health delivery so close to the edge, where because the least little blip, right, creates this spiral. And so, I mean, are you all thinking about that too, like within within the organization, people that manage like Sue and other people? Do you think that something is good going to come out of this on the other end, or are we just going to forget about it and just go on the razor's edge? That's a very long, rambly question, but I think you get it.
Yeah, first I should say we did furlough staff. We furloughed 160 of our staff, which is about 33% of our staff, which was, Bob, I know you've been in industry and from layoffs, but that was the first time I'd experienced that as part of a leadership team, and it was, I have to say, one of the most sad and painful things I've been through professionally. And we chose to furlough in hopes that we can bring folks back rather than to lay them off. But I do feel that the silver lining in this, what a painful silver lining it is, but the silver lining is that we're really looking at how do we make healthcare easier for people. Healthcare is so difficult. The system is so difficult to negotiate. And when we saw how quickly we were able to stand up the telemedicine when the barriers were removed, it was really an aha moment for us, And so we have actually convened, I mentioned this incident command, but part 2 of incident command we've dubbed Back to the Future. And it's a committee that's forming to kind of look at what are we learning from this? What are the takeaways? What is our health center going to look like in the future? And, how can we operate from a position of strength without sacrificing what we really hold dear, which is our commitment to our community, our commitment to cultural competency, our commitment to equity and justice.
Mm-hmm.
I
So,
really hope that a lot of
yeah,
other places are
just a
having the same
little thing to
conversations.
consider.
Yeah. I think that's why I love Lowell, because I know that these conversations are being had in places like this, and places that are serving the community in the most vulnerable populations, in a place that I love. And I personally love Lowell Community Health Center. And I think that it's really cool that, historically speaking, it has been led by women. Another really cool thing about Lowell, right?
Mm-hmm.
But this whole crisis, I think, really has exposed all of these kinds of issues and cracks in the systems, where if you could get telehealth that quickly, what was preventing, the funding for that before? And I really hope all of those things are being exposed in a huge way, so that we can bring about positive change for our communities and for our whole nation, really, and really the globe, right? Because I just want to save the world. But
Good luck with that.
yeah, exactly. Well, I think, with good people like this, we can at least do what we can in our corner, right?
Yep.
And I'm just really grateful to know that we have those conversations happening in our health center, in our community.
And I would say they're happening statewide. We have a really wonderful professional association, the Mass League of Community Health Centers, and they're really leading the charge on the advocacy level for changes that will streamline healthcare, but also to make sure that Congress continues to fund community health centers, because we've been funded kind of year to year to year, and we're seeking long-term sustainable funding.
You can't plan that way.
Exactly.
Right? I mean, you don't know.
Exactly.
It's sort of like, well, what do we want to be in 5 years? But behind the back of your mind is, will we have money, or will we? How many community health centers are there in Massachusetts? You said
there
there's
are
a group of you that are.
I believe. 52. So there's one nearby. There's Greater Lawrence Family Health Center, and then Fitchburg. It has a community health center. Those are the two closest to us.
Mm-hmm. And are they all across the state?
Yeah.
Do they all have to furlough people and sort of do the kind of permutations that you all had to do? Is it very similar in terms of how every one of these centers had to operate?
I would say for many it was. Some are really small, and so so especially out in the western part of the state, and some are really big. Some of the Boston community health centers are really big and attached to large medical institutions. So, but I would say we're not in the minority with having had to furlough staff, and we are one of the few health centers, from what I can tell, who have emptied the building. And I really, I have to hand it to Beth. That was a bold move, and I think it protected a lot of lives. Not just both patients and staff. And the key now is how do we organize reentry? That's going to be.
So you don't do any testing there, right? Or do you?
Not now. That's another thing the Mass League is working on. They'd really like to get testing into the community health centers, because they're a place of trust. So if you're someone who doesn't speak English, who's undocumented, who's that's a more likely place for you to go if you don't have a car, than to right now. We send our patients to Lowell General. They have a drive-through testing site. Some patients on their own go to the CVS drive-through site at Cross Point. So we're in discussions with the state and CVS, and also with the hospital, and Mass League is in discussion about how can we do this. But again, one of the gating factors is the lack of PPE. We can't do it if we don't have the PPE.
And yet at the same time, I mean, again, like when I listen to people talk about this, it's this chicken and egg, because if we want to slowly reopen, part of the way to slowly reopen is to be able to test and have access to frequent testing if it's necessary, so that you catch things. And making it more complicated or just somehow ignoring it and thinking, well, the testing will take care of itself, that's obviously not going to happen. And so the university, while you're doing what you're doing in the health center, I'm not part of it, but I know the administration is trying to figure out, well, how do we in the fall get the dorms open again?
Right.
It seems to me you cannot open the dorms and invite kids to back in to live on campus if you don't have the RAs with those gizmo thermometers like beaming into people's forehead, seeing if people have it, just the minimum, right, to figure out what do we do.
Yeah.
And again, like, where's the money going to come from to have on every floor in every dorm one of those cool thermometers, right?
Right.
And just that, never mind then, okay, well, you're 100.5, let's get you a test. Where are we going to do that? You can't send every student over to Lowell General, and it would be crazy to think that the UMass Lowell medical staff, as presently constituted, could test everybody.
Right.
So we'd be right back in the same, it's like, it's just a big intractable social problem, right? I mean, it shows the weakness, right? And the wealthiest country, supposedly, in the world is having basic trouble doing, and again, in Massachusetts, with all these biotech companies and all these medical companies and all these fancy medical schools. And I actually am surprised that it got as bad as it did. I mean, maybe that's because I'm a doctor in name only, and I don't understand medicine
You don't play one on TV.
Yeah, I do not. Yeah.
As surprising, or maybe, I don't know if I could say I was surprised, because I don't know that I have faith in the system. I don't know that I really have, but I do have faith in community, and I do have faith in people power, and I do have faith in Lowell. And I do want to say thank you so much, Claire, for joining us today on History in Lowell and giving a little bit about our history of the Lowell Community Health Center and what your efforts are right now during this really crazy crisis. Thank you so much for your dedication to our community. And, on behalf of Lowell, even though I'm not currently a Lowell resident, Lowell forever, I am so, so grateful that the health center exists. I know I used to go there all the time and use it and utilize it. So thank you for, being around. Thank you for existing. Thank you for being here today.
If I could just give a little shout out, Bob and two honor students, Katie and Lindy, put together this incredible timeline for us in our building. And when we reopen, I hope everybody will come look at it, because it was really, it really connected me to the mission. It was really a wonderful experience, and it's a beautiful timeline. So thank you, Bob.
Everybody stay well, wash your hands, sing happy birthday while you're doing it, and see you all in 2 weeks.
Okay, take care.
Thank you.
Thank you.
you.